so continues her gradual back down from Medicare for All.
When Kamala Harris first launched her primary campaign, she supported Bernie's Medicare for All bill. She is a co-sponsor on Bernie's Medicare for All bill. But now, as we've seen through town halls and the debate, when she's on stage, she says some of the right things. But then when she's questioned about it afterwards, she always walks back her answers. And I have previous videos on that. But now she's being at least somewhat honest in saying that she has a different direction for Medicare for All. And she described it in this Medium piece titled, "My Plan for Medicare for All." Now, before I even get to her points here and what her plan for Medicare for All is, she's being totally dishonest calling this Medicare for All. This is not Medicare for All. But she is trying to use the popularity of the brand, the name Medicare for All, to try and sell her version of Medicare for All, which, as you're going to see, is largely a profit-driven bill. So let me get to the first point here that she throws out there, and that's that Americans will have the ability to buy into Medicare immediately. Fine. That's also in Bernie's plan. Bernie's plan that is implemented over 4 years. Kamala Harris's plan is not. And the second point here is when we begin to get into some serious issues. Second, we will set up an expanded Medicare system with a 10-year phase-in period. A 10-year phase-in period. So let's pretend perfect world. Kamala Harris, day one, passes her Medicare for All plan. She wins a second term. She has 8 years of a presidency. Her Medicare for All plan is still not fully implemented by the end of her second term. This is nuts. So as Bernie's National Press Secretary breaks down here, the health insurance plan proposed by Kamala Harris has a 10-year phase-in. If Obamacare had a 10-year phase-in, Donald Trump would have taken office a little over halfway through the transition and tanked it. This is not a serious plan. We need Medicare for All. Bernie's plan has a 4-year phase-in. The first year, it lowers the Medicare age to 55. The second year, it lowers it to 45. Year 3, 35. It adds dental, vision, and hearing benefits to Medicare to Medicare year 1 and provides for continuity of care for folks with private insurance. It rocks. Healthcare as a human right means no premiums, no deductibles. Under Bernie's Medicare for All plan, the maximum anyone will pay in co-pays for prescription drugs is $200 a year, total. So this is one of the main differences here between Kamala Harris's plan and Bernie's plan. Kamala Harris's plan somehow is going to be instituted over the course of 10 years. And as you're going to see, even when it is instituted, it is still not Medicare for All. So getting to her third point here, her version of Medicare for All actually expands Medicare to private interests. So some people know this as Medicare Advantage when it comes to senior care, but she's expanding this to cover the entire Medicare plan. Now, it's not really Medicare if you're including private insurance companies, but here's how she describes it. Third, in setting up this plan, we will allow private insurers to offer Medicare plans as a part of this system that adhere to strict Medicare requirements on costs and benefits. This would function similar to how private Medicare plans work today, which cover about a third of Medicare seniors and operate within the Medicare system. So, what she's describing there is Medicare Advantage, the Medicare for seniors. So she would expand that to be all of Medicare in her Medicare for All system. Here's the problem. Medicare Advantage screws people. So this reporting from the New York Times from 2018. Medicare Advantage plans, the popular private insurance alternative to the traditional Medicare program, have been improperly denying many medical claims to patients and physicians alike, federal investigators say in a new report. The private plans, which now cover more than 20 million people, more than 1/3 of all Medicare beneficiaries, have an incentive to deny claims, quote, in an attempt to increase their profits, the report says. Profits over people, you don't say. It turns out when you have private interest in the healthcare system, they prioritize their own profits over actually helping people that need health care. This is the exact problem with the current American system. You have these for-profit interests driving the system, and it would be the same case under this plan. So even though Medicare Advantage falls under Medicare, as Kamala Harris says, as this piece says here, it is still screwing people. You cannot have for-profit interests undermining the healthcare system. I mean, there is no benefit to having them in the system unless they're your donors, unless they're your friends, unless they're showing up to your private fundraisers. Why else would you support a system like this? This is not a single-payer system. A true single-payer system puts everybody on the same plan, which in turn lowers costs across the board. And it also means you have full choice of your doctor, of your hospital, because everybody's under the same plan. I'm Canadian. I get how this works. Kamala Harris is lying to you. This is not a good plan. Now, I'm going to show this clip here from Fashakir. So this is Bernie's campaign manager. I mean, obviously here, look, he's going to have a bias. He works for Bernie Sanders. But listen to the points that he actually makes here.
Fashakir tweeting this morning, so continues her gradual back down from Medicare-for-all. This is why you want a candidate with a lifetime of consistency and a track record on the big issues. And guess who's with us now? That man, the 2020 Bernie Sanders campaign manager, Fashakir. Thank you.
Hi, Poppy.
For being here. It's great to have you in person.
Good to see you in
Usually
person.
we're remote.
Yeah,
Thank you for
indeed.
taking the time. How is this a back down if it gets us to Medicare for all in a decade?
Well, she started with supporting Bernie Sanders' Medicare for All as a plan, and so we appreciated that. Now she's moved away from it. Unfortunately, I think we've seen two major changes, right? One is she's decided she'd like to privatize Medicare. She'd like to introduce more insurance companies into Medicare. Obviously, that introduces more corporate greed and profit seeking into the Medicare program. That's dangerous for Medicare in general. The second thing she says she wants to do is phase this in over 10 years. I mean, not in one term of a presidency, not in two terms of a presidency, but that you'd have to wait 10 years for people who've been struggling for a long time
so
for care.
former HHS Secretary Kathleen Sebelius is lauding this plan and saying this is what we need right now. She is saying that she can do it without raising taxes on those who make under $100,000 a year. I hear your point. I do. But you need to convince the American people. And you know what the Kaiser numbers from this year's poll show. 58% of Americans like Medicare for all. But when you tell them that they cannot have private insurance as an option, that support drops to 37%. Isn't that a problem?
First of all, Poppy, a few things to break down there. I appreciate Governor Sebelius. She's a good friend. She's been a good ally. She happens to work for Medicare Advantage companies who are going to benefit under this kind of a plan. So let's be honest about when people critique it. Where are they coming from? We've offered a pledge, as you probably remember, Bernie Sanders saying that we should not take any money if we're running for president from health insurance companies and pharmaceutical companies. Elizabeth Warren, I think, said she would take that pledge. I don't believe Kamala Harris said she would take that pledge. And I think what that means is, are you willing to fight these health insurance companies and the pharmaceutical companies when you're in the Oval Office? And I don't think we know that. I don't think that we have confidence that she is. And obviously the plan here is suggesting that there's some concern over taking them on.
All right. So listen to what Fashakir is actually saying here. And I'm actually going to expand on one of the points and also answer one of the questions that wasn't answered in this clip here. But so first off, Kamala Harris did not sign the pledge to not take private health insurance or healthcare money, showing you maybe why she's defending private healthcare companies here, the profit-driven health interests that want to continue being able to make money off of sick people. But Elizabeth Warren did, just to give you an idea that this is not, even though, yes, Fashakir works for Bernie Sanders, he's being honest here in terms of who has signed this pledge and who hasn't. Elizabeth Warren is not taking that private healthcare money. Kamala Harris is completely open to it. Kamala's plan here, as I said earlier, expands Medicare Advantage, or the private arm of Medicare. Now, the CNN anchor here says, well, Obama's HHS Secretary, Kathleen Sebelius, well, she supports it. So, what does that say? It's a good plan, right? Fashakir brings up the correct point that I'm going to showcase to you here, that Kathleen Sebelius works in Medicare Advantage. That's what she does now. Of course she's going to support Kamala Harris's plan that expands that. Are you kidding me? So this reporting from Axios in 2017. The newest Medicare startup Keep this on your radar. My colleague Bob Herman reports Devoted Health, a new insurance company that will only sell Medicare Advantage plans, just raised $62 million, according to a new financial disclosure. The startup will start selling Medicare Advantage plans in 2019. The players, some big names, are backing Devoted Health. Former HHS Secretary Kathleen Sebelius. Oh, who knew? And read the bottom here. This point is, I mean, it's amazing they made this point. Medicare Advantage is where the big money is. The ACA marketplaces grab a lot of headlines, but they are a blip on the radar when compared with the hundreds of billions of dollars tied up in private Medicare plans and care for seniors. Now, you may wonder, okay, but what's the problem? What's the problem with that? Well, as I showed you earlier, Medicare Advantage is screwing people. That's the problem with that. And Kamala Harris wants to expand that screwing to everybody else as well through her version of Medicare for All. And just to put a blip on that point, or I should say a pin on that point, look at the Devoted Health page, look at the board of directors. Yes, Kathleen Sebelius is indeed on the board of directors for Devoted Health, a company dedicated to offering Medicare Advantage plans. Now, I just want to hit on one point here that wasn't answered in that clip, where CNN brings up, only 37% of people support Medicare for All when they're told that they lose their private insurance. That when they no longer have a private insurance option, only 37% of people support Medicare for All. It's kind of weird that in addition to CNN not bringing up the fact that Kathleen Sebelius is benefiting from Medicare Advantage, it's also weird they didn't bring up this poll from Morning Consult that shows, when you look at the dark blue, a Medicare for All system that diminishes the role of private insurers but allows you to keep your doctor and hospital. All voters, 55%. Democrats, 78% support. Independents, 56% support. So when you actually tell people, yeah, you lose private insurance, obviously under a true Medicare for All plan, but you, of course, keep your doctors and your providers because everybody's on the same plan. It is a single payer system. People still want it. So that's the distinction here. If people think they're going to lose something because the wording in a poll makes them feel like, I'm going to lose out under Medicare for All because they're taking away my insurance, but they're not taking anything away. Nobody actually loves their private insurance company. The private insurance company is not what people want to keep. It's their doctors and their providers, the hospitals. They want to keep that. So under a Medicare for All system, you keep all of that, in addition to all the other benefits like the freedom, never having to worry about, picking different plans or figuring out what plan to go with, or who I got to pay back, or what money you have to have on hand in case there's out-of-pocket expenses. Not to mention the freedom of being able to, say, leave your job and go somewhere else, maybe start a new job, but you're afraid to leave your job now because you have great insurance through your employer. Medicare for All frees you up. Leave your job, start a business, maybe even hire people and not have to worry about giving or getting them health care in a small business because they already have health care through a Medicare for All system. I mean, there are endless benefits to Medicare for All. As a Canadian, again, it's even hard for me sometimes to recognize all the benefits because I've always lived in this system. I don't know what life is like outside of it, but I can tell you when I read reports and just hear from people's experiences under this for-profit healthcare system in America, it's completely nuts to me. True Medicare for All, the plan that Bernie Sanders is offering, the plan that even Elizabeth Warren supports, true Medicare for All is the actual answer here. What Kamala Harris is trying to sell you is just a package of lies.